So the first thing that I wanted to talk about was this, the kind of stereotypes and the myths around ADHD. So there tends to be a very typical idea or image of what ADHD looks like. So quite often we'll think about hyperactive boys, bouncing off the walls, struggling to manage angry impulses, really untidy, really chaotic. And quite often that's been the view. That's how they've tended to be the people who've been diagnosed with ADHD over time. And when we have a young person who struggles with their behavior, quite often the go-to concept or conceptualization of what might be going on is ADHD. And also we think about that inattentiveness, that struggle to focus or concentrate in the classroom. But the reality of ADHD is actually much more complex. So a lot of people with ADHD are living undiagnosed. They know they struggle. They know they find things difficult, but they don't know why. They think they're just maybe not disciplined enough, or don't have enough skills, or are not motivated enough, or just have poor organization. They might not necessarily know. So people think ADHD is quite a simple concept, but actually there can be lots of difficulties underneath the surface that actually are related to ADHD. And we don't always see them. So a lot of these are internalized, and we don't experience actually how it feels for that person unless we see that hyperactive presentation. And I love this kind of iceberg model. I think it's really helpful for thinking about a lot of educational needs, because there's the bit we see and there's a huge amount under the surface that we don't see. And quite often with my students, we draw the iceberg for whatever's going on with them, and we help them work out what are the bits that everyone else is seeing, and actually what's underneath the water in your iceberg. What are the bits we're not seeing that's driving these difficulties? I'm going to talk just a little bit, not at length, but a little bit about definitions of ADHD. So in the UK, any diagnosis that's given of ADHD has to be done according to NICE guidelines. There are companies online which are giving private diagnoses, not necessarily using these guidelines, but the guidelines mean that it's kind of robust and it's a clinically accepted diagnosis. And the NICE guidelines are drawn from two sources, really. The DSM-5, which is a diagnostic and statistical manual, which is mainly used in the USA. It's not often used. For example, it's not used in the NHS here. But from that, and also the ICD-11, which quite is actually a classification of disease for coding of mortality and morbidity, but it's the World Health Organization's accepted guidelines really for disease and illness. So one of these documents is just about what they call disorders, but really conditions of the mind, and one is about the whole body and the mind as well. It has less detail about ADHD than the DSM. So this is really key. So this is just some quoting from the NICE guidelines. And I think it's really important because if you work in a school, quite often you will have families asking for school to diagnose ADHD, or for us to ask an educational psychologist to diagnose ADHD, but it's classed as a medical diagnosis. So for me, in my role as SENCO, I can't give a diagnosis of ADHD. I can spot what I think might be going on for a child. I can make a referral into the NHS or another provider for an assessment, but I can't diagnose it myself. Equally, even an educational psychologist wouldn't be able to give this diagnosis because it has to be somebody with a medical clinical background. And it has to be based on difficulties being observed in a range of settings. So not just at home or not just at school, but across the board, really. And that's a real challenge for some of our young people who have ADHD, but who mask it at school or mask it at home. And we don't always see the full picture of how much they're struggling. And that can sometimes present a challenge if they're not seeing those symptoms in school. And usually for diagnosis of ADHD, school and family, and quite often the young person themselves, will be asked for their feedback and information on questionnaires. Probably if you work in the school, you've been asked to fill in these questionnaires at some point. And all of that information will be pulled together to see if they meet the diagnostic criteria. So it has to be according to the criteria in the DSM or the ICD-11. It has to be evident in multiple settings, and it has to have a level of impairment. So it has to be having an impact on their functioning. So again, nice guidelines, but I think these are really, really helpful because there's a huge amount of interest at the moment in ADHD, and I think it can be really helpful to pin down what it is really that we're talking about and looking at. So there are young people who will struggle with elements of organisation or impulsivity who might not necessarily meet the criteria for a diagnosis of ADHD. So we're looking at these kind of symptoms. So difficulties that have started early on, that have occurred in several settings, been present for a long period of time, for at least 6 months. It can't be a very recent change, that have interfered with their quality of functioning, and that can't be explained by another difficulty or disorder. So when we're thinking about inattention, so the inattentive symptoms are things like struggling to give close attention to detail, making careless mistakes, struggling to keep concentration. So the children that you've probably got in your class that you spot staring out the window, or you realise they're not listening at all, or they're the one fiddling with a pen or tapping. Quite often those young people will be struggling with inattentiveness, and not being able to listen to what's being said, or struggling to follow through, or struggling to organise, and not being able to do tasks that require a sustained mental effort, and often losing things, being easily distracted, or being forgetful. All of those are inattentive symptoms. There are also hyperactive and impulsive symptoms. So when we're thinking about that very hyperactive young boy kind of with huge amounts of energy, that's very much these hyperactive impulsive symptoms. So lots of physical movement, not being able to sit still in a chair, so moving around, leaving their seat in the classroom, running about or climbing in situations where that's not appropriate, struggling to do things quietly, and just being on the go all the time. And if you're supporting in schools, I'm sure you've got young people that you support who meet this definition, where they are just constantly moving and not able to settle. And that can include talking excessively, blurting out answers before the question's even been completed because they're so impulsive, they struggle to be patient. They've got a very fast mind, very fast motor, struggling to wait their turn, and interrupting or intruding on others, not being able to wait till someone's finished what they're saying before they cut in. So there are different presentations of ADHD according to the two diagnostic frameworks. So there are young people who just have inattentive symptoms. They're not hyperactive and they're not impulsive, but they are really inattentive. So they're the ones who wouldn't necessarily be running around all over the place, but they do really struggle to focus and concentrate. The DSM has a range of different categorizations of ADHD. So they have a predominantly inattentive type. They have a predominantly hyperactive or impulsive type. They have a combined presentation where the person has difficulties with concentration and they're hyperactive and impulsive. And also there's a partial remission category. So that's where the challenges seem to be improving over time. And the ICD has 5 ADHD subcategories, again, quite similar, predominantly inattentive, predominantly hyperactive and impulsive, combined, and other, and non-specified. It's important to know this because there will be children that you work with who have ADHD who are not hyperactive. And they'll be the ones who are struggling to manage, struggling to function effectively, but there's no kind of reason why. They're the kind of children that we think, oh, they're daydreaming or they're not focused, they're not engaged. But actually what can be going on for them is that they really struggle with attention and concentration, even though they're not hyperactive, they're not running around the place, they're not talking excessively, but it's very hard for them to focus, particularly on things that they're not interested in. Our understanding of ADHD is developing and changing all the time, and it will continue to change. So it was first noticed in about 1900 when George Frederick Still noticed that there was some kind of difficulty with moral control in some children. That's obviously quite archaic language now. But he noticed that some children couldn't control their behavior in the way that other children could. But they were intelligent children, but it was that impulse control that he noticed. In the 1950s, there were trials to use stimulant medication as a treatment for ADHD. And it was noticed that that seemed to make a difference for these young people. You'd think that giving a hyperactive child a stimulant medication would make things worse, but it stimulates the regulation part of the brain so that they can manage those impulses more effectively. And in 1968, the second DSM was published, and they gave this a name. So the name they gave was hyperkinetic reaction of childhood. So young people who are hyperkinetic, hyper-moving. And in the third DSM, it changed from hyperkinetic reaction to ADD. And at that point, they came up with two subtypes. One was ADD, and one was more like ADHD with hyperactivity. And at the moment, we're kind of moving on where we've got these different subtypes, combined ADHD, the inattentive type and the hyperactive type. But who knows where our conceptualization will go in the future? We're understanding more about the human brain all the time, and I'm sure it will continue to become more nuanced in the future as studies continue and we become more aware. The understanding of ADHD, I think, has to fall into the wider umbrella term, really, of neurodiversity. Because we know now, and we're learning more about the fact that there's a huge range of brain types within the human population, much more than I think we ever understood in the past. And the more you understand about this, the more you will spot this in people you know, that actually we all think about things in very different ways. And sometimes those brain types bring with them strengths as well as challenges. So ADHD really is best seen within that range of different brain types in the general population. There's often a lot of overlap. So a lot of young people with ADHD also present with other need types and conditions. And sometimes this is called comorbidity, but it's where we have overlap. And you'll have young people you work with who have several diagnoses or more. I've had young people with up to 5 or 6 diagnoses, but there's a very common co-occurrence of ADHD and autism, and sometimes that's now called ADHD, and that presents a different set of challenges, I would say, because the ADHD side of the person needs stimulation and interest and engagement and exciting stimulus, whereas the autistic side of that person sometimes needs routine. So it can be quite a tussle. I'm not going to focus on ADHD in this session, but if you're interested, it's worth having a look online. But there are lots of different co-occurring conditions that can exist alongside ADHD. Social anxiety disorder, rejection sensitive dysphoria is very worth being aware of. So this is some young people, some adults as well, are particularly sensitive to rejection to the point that it's quite disabling for them if they feel they've been criticised or laughed at or judged. And even in schools, if they're given feedback on a piece of work that's not wholly positive, they can really take that to heart. Dyslexia, Tourette syndrome, depression, dyspraxia, quite often called coordination delay now, sleep disorder, and dyscalculia. So all of those things can exist alongside ADHD. So if a child you work with is diagnosed with ADHD, that might not be the full answer. There might be other things still to unpick and uncover for them. And our understanding really of human neurodiversity is growing all the time. And I think in schools, certainly since I started teaching 20 years ago, we've come a long way, but there's still a lot more to do. So thinking back in the past, even kind of 50, 60 years ago, young people with complex needs in schools were just not understood. They, for example, if you had a young person who couldn't read or write and couldn't pick it up, they would have been made to sit in the corner, literally, with a dunce's cap and punished really for not quite picking it up, not being able to read and write. Whereas now we understand more about dyslexia, we understand how to work with young people with dyslexia, and we can work with those young people in a proactive way. So we're constantly developing our understanding of neurodiversity. What I think can be quite tricky sometimes, and I'll come on to this a bit later, is the way that we run our schools hasn't necessarily modernised at the same pace of our understanding of different brain types. And that can present a challenge for what we're doing with young people in schools. If you think about young people with learning disabilities and even physical disabilities in the past, there was not an inclusive education system in the UK. So even up until the 1950s, those young people would have been taught in kind of specialist or kind of very separate settings. Even if they didn't have any learning difficulties, they would not necessarily have been allowed to go to school alongside their mainstream peers, or they might have been taught in a therapeutic ward and done some craft and some activities. But there was a huge range of young people who were thought to be ineducable. Now we've moved more towards an inclusive education system. So a lot of young people with SEN in mainstream or have the option of going to mainstream. But lots of our systems in society have been set up with neurotypical people in mind. So if you think about everything really from the supermarket, the classroom, applying for jobs, a lot of that was designed very much with one brain type in mind. For a lot of people with ADHD and other needs, those systems don't necessarily work very well for them. And you see little steps towards things becoming more inclusive, like supermarkets sometimes have a quiet hour on the weekend for people who struggle with all the noise and the sensory overload, and that's really positive. But there's definitely a lot more to do. And I think in schools, we a lot of us kind of went through the school system, so it's hard to imagine anything very different. But it's clear a lot of young people are really struggling with the way things are in schools. And that can make it quite difficult, quite traumatic. And a lot of the children you're working with will probably be showing you in their behaviours how difficult they're finding it. I'll come back to some of that in a bit, but I was going to talk a little bit next about the diagnostic process and its limitations. So if you work in a school, you will almost certainly have young people who have a diagnosis of ADHD or who want a diagnosis of ADHD. In my school, for example, I'm in a secondary mainstream school. I did about 60 referrals for ADHD assessments last academic year. So there are lots of people who are keen to see if there's if their young person meets the diagnostic criteria. And there are lots of advantages to this, but there are disadvantages as well. So, as I mentioned earlier, ADHD is a medical diagnosis. So, certainly in Bristol, schools can refer into the NHS for assessment. GPs can refer into the NHS for assessment, and here in Bristol, it's contracted out to a company called Serona, and families can also commission a private diagnosis. There's also another system called Right to Choose, whereby families can select via the NHS a private provider for an ADHD assessment. So in Bristol at the moment, the waiting time for a diagnosis is about 2 years. So students who meet specific categories are prioritised, but generally it's a 2-year wait. So there's some real limitations really on us relying on that diagnostic process. So a lot of the children that you work with ADHD actually won't have a diagnosis. Either they'll be waiting for an assessment, or no one will have spotted that that's what's going on for them. But even with a diagnosis, if school staff don't understand ADHD or make adjustments, then that child's experience in school is likely to be quite poor. And there will be children who present with symptoms of ADHD, but who don't meet the criteria for diagnosis. And that's really challenging as well, because there's a need that needs to be met, but they don't quite tick enough of those features. For us, working in school, we can make a difference to those children. With or without that piece of paper, we can use the strategies. And none of the ADHD-friendly strategies that you would use in a school would ever harm anyone. They're all things that can be generally useful for lots of children. It's absolutely fine to be using those strategies with children without a diagnosis. Thinking about the topic of prevalence. So the inattentive subtype is about 20 to 30% of cases, and hyperactive impulsive is about 15%. The majority of young people with ADHD have a combined subtype. So they'll have some inattentiveness and some hyperactivity, and they'll be impulsive. So you'll see some of that, all of those features in them. And it's estimated that the global prevalence of ADHD is about 5%. But in the US, so studies based on the US populations estimate that at 8 to 10%. One key thing is that ADHD is more commonly diagnosed in boys than girls. And the ratios can be quite shocking. So it's anything between 2 to 5 boys to 1 girl, even up to 10 boys to 1 girl. And we think that that's because of the way that boys with ADHD tend to present. So quite often, boys with ADHD will be showing that disruptive, impulsive, challenging behaviour that leads them to be referred. But quite often, girls will just be really struggling inside, really, with inattentive symptoms. But they're not acting out with challenging behaviour. No one's seeing the struggles necessarily. They might just think, oh, they're a bit of a dreamer. And actually, because they're not acting out, they're not diagnosed as much. And there's a huge number of adult women who are being diagnosed later in life, quite often in their 40s, when hormonal changes around the perimenopausal phase happen. And that's when things become very difficult. That hormonal interaction with ADHD can really cause things to be difficult. And there's a spike in diagnosis rates for women in their 40s. Here in the UK, the prevalence of ADHD in adults is about 3 to 4%, and our male to female ratio is still really high, about 3 to 1, males to females. I think one of the lessons of this for us is thinking about the young people we work with who struggle with learning but aren't hyperactive and don't act out, and really trying to pay attention to the underlying causes, because some of those young people would be really struggling to focus. And what I see a lot in my work at the moment is what I call the ripple effect. So the needs will be identified in the child. So a child will come to me, or a parent will come to me concerned about their child, and we'll go through a process of identifying ADHD. They might eventually get a diagnosis as well. We tend to put support in even without a diagnosis, so they're not waiting, but that will happen. And then the parent will realise they also have ADHD. And I've even had grandparents who've then gone through that journey and that process as well. We see this kind of understanding of ADHD and how it presents rippling through whole families. I'm going to talk a little bit about the features of ADHD. And it's not just about that hyperactivity. This one I think is really key. So for a lot of people with ADHD, they're very, very strongly interest-led. So if they're interested in a topic, they can work on it and focus on it for a very long time and with full attention and concentration. And that's why when you have staff who say, well, he can't have ADHD because he focuses really well in my lesson, it may be that that's the subject of interest to him. And they can do what's called hyperfocus. So they can focus for long periods of time on things that are interesting to them. Much longer than for other subjects or other people. But if it's something that they're not interested in, that's boring to them, it will be almost impossible and quite painful for them to focus on that for a long time, because it's just not engaging to them, it's not interesting to them. So whereas a neurotypical child might be able to put a reasonable amount of attention into all of their subjects because they know it's important, ADHD children will struggle with that. They'll be able to do it in some subjects and not in others. That makes school really tricky, because in school you have to do a full range of subjects, whether they're interesting to you or not. You have to do them, you have to do the full curriculum. College gets easier for ADHD as usually, because even though they might struggle with the organisation of deadlines and having to study a bit independently, they've had a choice in what they're studying, they've had a choice in what they're doing. And so the fact that they have less time spent on topics that are boring to them is already a huge advantage, as long as they choose the right course. And the same is true of university. And if they can get into a job that's interesting to them, then they will absolutely fly and excel, because that's really where their interest and their passion lies. So you wouldn't expect good engagement across the board for kids with ADHD. And there's not a huge amount you can do with that, apart from some of the strategies I want to talk later on. They're not suddenly going to be over the moon about the subject that they're not interested in. But there are little tips and strategies that can help. A lot of people with ADHD have really strong emotions, so their emotional range can be much wider, and emotions can be felt much more intensely than for neurotypical people. So when we've got young people or younger children with ADHD, quite often that will present as tears, anger, tantrums, very hyperactive excitement about things. You can see that whole range of emotions. And for for teenagers, for example, it might come out as kind of more difficult mood swings and higher strength of elation. But you'll see a really wide emotional range. Sometimes even within a few days or a week, they might experience that huge range of emotion. And they feel things very strongly. It's worth talking about dopamine. So dopamine is really the reward chemical in the brain. And people with ADHD have generally lower levels of dopamine than neurotypicals. And that means it kind of affects their motivation, and it can affect their mood. It can be really difficult to keep focused without enough dopamine. One of the challenges for teenagers and young adults with ADHD is that this can lead them into risky kind of situations. So anything where there's risk and reward releases a hit of dopamine. So quite often young people with ADHD are more prone to getting involved in risky behaviours, like compulsive shopping or substance use, or even kind of risky sports like parkour. I've had a young man who's kind of been riding his bike in the road, and anything that's kind of brings excitement and risk will give them a hit of dopamine, but it can be in quite a risky and unhealthy way. So we do a lot of work with our young people. In my school, I run a psychoeducation group called ADHD Masterclass. So we help our young people to understand about this and the risks, and to think about healthy ways to find dopamine that don't put them at risk. Executive functioning is one of the major challenges for people with ADHD. And put very, very simply, it's the ability to do stuff. It's the ability to carry out actions. And it can be really, really difficult for people with ADHD to make a plan to do something and to actually carry it out from beginning to end, because that process can be very difficult at different stages. So, for example, a lot of ADHDers will have a task to do that's actually a really simple task, something they could do in 10 minutes, but they will put it off and off and off, because that getting started is actually incredibly difficult for them. When I'm working with young people, I just say, look, on the first day that you've got this piece of work to do, literally just sit down and write the title and date and then leave it. Because that getting started is actually 40 or 50% of the effort for them. Once they've done that, the next bit will be much, much easier. This can make it really difficult, though, to keep on top of homework, to keep bedrooms tidy. All of those kind of things which we expect of young people are really difficult for ADHDers because of executive. And for a lot of people with ADHD, sleep is a challenge. Either they struggle to get to sleep, or they wake up in the night lots of times, or they sleep badly. And that impacts further on their regulation the next day because they become tired. And when we're tired, our body and our brain fills up with adrenaline to keep us going, keep us awake. And adrenaline, again, overstimulates us, and that can cause reactions. Things can spiral. So sleep can be a real challenge. And socially, people with ADHD can end up struggling because they struggle to do turn taking. They might interrupt people, and then they have toxic. They feel shame, and then things can spiral because they feel bad, and they can find it really difficult. They also, quite often, people with ADHD are very harsh on themselves, mainly because of the amount of negative feedback they've had over time. About how they're doing in school and how they're managing. So they can be very harsh. They can experience real shame around how they're managing socially. And this kind of sensation of feeling just general overwhelm. When I do work with young people with ADHD, this is the emotion that they describe most frequently. That they just feel utterly overwhelmed. And that can be worse when there are exams, when there are deadlines, when there are social things, and it's all stacking up. And the way they feel is just, it's all too much. They feel overwhelmed. I'll talk in a little bit in the second part of this session about strategies for managing overwhelm. And a lot of ADHDers will also use what's called a fawn response. So they will basically try and please people. They'll say yes to things they're asked to do, even if they don't want to do it. They'll try and keep people on side by doing what people want. And it's a trauma response, really. It's about the fact that, again, they haven't been able to be the way people want them to be. So they are surviving by trying to please. And eventually, burnout is unfortunately quite common for ADHDers. So this sense that I've tried to keep going, managing all these different things for so long. And it's just caused me complete exhaustion, and eventually it can lead to burnout if it's not managed in the right way. And I often, when I'm working with young people who think they might have ADHD, there are two questions I usually ask off the bat. The first one is, how tidy is your bedroom? And the second one is, do you like maths? Because it seems to me, this is just my observation, that most people with ADHD really seem to struggle with math. I don't know why, but that's something I've observed with about 90% accuracy in the young people I work with. But the challenge of this is ADHDers need a tidy, orderly space to function, to be able to stop being overwhelmed, to be able to find things and not burn out. But they are not tidy. And that's a problem, isn't it? Because you're not a naturally tidy person, but you need a tidy space. And we'll talk about some strategies for working through that. Before we break, so there are some kind of helpful perspectives, I think, about ADHD. And I quite often use these with my students to help me understand what's going on for them. The first one is, I think, the best description of ADHD that I've found. It really resonates with me. And it's this idea that ADHD is a chronic restlessness of the mind. I always notice this because sometimes you'll say to a friend, what are you thinking about? And they might just say, well, nothing. And they'll genuinely be thinking about nothing. Whereas for an ADHDer, that is impossible, that you wouldn't be thinking about something. Your mind is constantly churning over, probably not just one thing, but 3 or 4 or 5 things all at once. It's like a very turbulent sea. The second one, ADHD is like having a BMW brain with Mini Cooper brakes. So really fast brain, really powerful brain, but without the brakes, without the ability to control the impulses and to pause things when needed. ADHD in girls is often inner hyperactivity, whereas in boys, it's often an outer hyperactivity. So for girls, that hyperactivity is in their brain, but for boys, they externalize it, they act it out. And the last one, and this is something one of my sixth form students said to me, the hardest part of ADHD is feeling day in and day out that you're managing everything worse than other people. So you can imagine the cumulative effect of feeling like that over many years, over 12 years of education. That's why there's an impact really on mental health and self-esteem over time. So these features might present differently in different young people. So these are the kind of things you might see. And I think it's helpful to be able to, with young people you're working with, you can spot whether this might be what's going on for them. So if they have hyperactivity, how that will present usually is fidgeting and not being able to sit still and running around. And impulsivity would present as seeming to do things where you think, why on earth have you done that? What were you thinking is what they often hear. What were you thinking? And really they kind of weren't thinking. They'd done the thing before they'd actually thought it through. It was an impulse. So they weren't quite in control of that decision. Maybe they were doing something risky for a dopamine hit. Maybe they were doing what their friends told them because that will bring them social favor. Maybe they just wanted that sensory experience without thinking about the possible risks. And the interest-led element would be that they can really focus on some things, but often not on other things. They can be really easily bored. One thing I think that's relevant as well is the smartphones and gaming. So a lot of ADHDers, those kind of games and really give lots of hits of dopamine because they're created to give you risk and reward. And so you often see young people with ADHD becoming really absorbed in either their phone or gaming because that meets their need and can become a place of that's quite soothing actually for them, where they're avoiding all the tricky bits that they find really hard. And the rejection sensitivity. So this is where what you'll see is their mood just spiraling if they feel judged or criticized. So if you're working with a child and they're told off and their behavior gets much, much worse as a result, it may be that they're just really sensitive to shame. They're feeling shame, they're feeling judged. And so sometimes that can be where overdoing on the praise and really limiting the negative feedback can actually make more impact. The shortage of dopamine, what you might see would be young people who are really bored by routine, even though they need routine, but bored by routine and drawn to kind of risky but rewarding actions. And the executive functioning, you would see young people untidy, disorganized, they'll struggle to get started on things, more than the typical teenager, I would say. It will be really disabling. It'll be quite distressing for them, the extent to which they can't do things that they need or want to do. There are lots of strengths as well to having ADHD. So a lot of ADHDers have lots of energy. Use this so I can see. They can be very sensitive to other people and their feelings, and that can be a strength because they can attune to other people. Quite often ADHDers can multitask really well. So they can be working on lots of different things all at once. Some ADHDers say it's like I've got 30 tabs open in my brain, and they're all open at once, and I can flip between them at will. Often ADHDers are really competitive. They really want to be first and be best, and that's something as school staff that we can use to our advantage. They can be really creative. A lot of famous artists, musicians, actors have ADHD. And amazing periods of hyperfocus on things that interest them. They'll have a fast brain often, they'll have rapid problem solving. Quite often ADHDers are brilliant in a crisis. Extreme perseverance. So if you say to an ADHD person, you will never do that, you'll never achieve that, quite often that is like a red rag to a bull, and they will commit to proving you wrong and doing that thing. As I mentioned earlier, the male and female presentations are often quite different, not always, but quite different. So quite often the males with ADHD do tend to display more hyperactivity, more impulsivity, more aggression. And quite often it's for boys and men, it's about kind of immediate gratification, that dopamine hit, and that's what can lead to reckless behavior. And males may struggle with social skills more, and with making and keeping friends. Whereas females, it tends to be more about the inattentive side. So um, adult females with ADHD might really struggle with completing things, remembering details, staying on top of responsibilities, might struggle with emotions and be more prone to mood swings, and might experience more associated mental health difficulties than males, like anxiety, depression, and self-doubt. Um, there is a very strong correlation between ADHD and poor mental health. Um, and quite often this can be anxiety, depression, low mood, volatile mood as well. So changes in moods, like mood swings. And we think partly that's because young people with ADHD, the way that schools set up, the way that we expect young people to be, is very much about kind of sitting still. It's teacher led. Schools are still very much about kind of being still and quiet and quite compliant, particularly in secondary. And that's really hard for people with ADHD. So children with ADHD on average have had 20,000 more negative messages by the age of 10. So you can imagine the impact of that amount of negativity on the brain and the impact that that has on the person's self-esteem when that amount of feedback is negative. Sit still, listen, focus. You need to remember this. You need to try this. That has a huge impact on the person. So I think it's very tempting when you're working with teachers in schools and they're under pressure for them to want to fix the problem, to solve the problem when you've got young people who are presenting with ADHD. So quite often the strategies that come up are about helping the child to focus, concentrate and behave better. But actually, because of the way that we structure schools, it's not necessarily an environment that is the best fit for not just for young people with ADHD, but particularly for young people with ADHD. It doesn't play to their natural strengths, it doesn't play to their talents. It's very much a system really that's working against the grain in terms of what they need, which quite often is movement and an interesting, kind of exciting curriculum with lots of opportunities for breaks and socialization and kind of a practical learning style quite often. It's worth thinking about this because anything you can do in your settings that will make it meet those needs better, you will see an improvement in the situation for the young person. So it's not about them trying to learn skills differently or them trying to learn to regulate. It's about what do we do, what do we wrap around them to help them succeed and thrive and to help bring out their unique strengths. I'm going to talk a little bit now about strategies. This, I think, is the absolute key one for young people with ADHD, and it's being able to really lend them your empathy and explain to them that you recognise how tough it is for them and that it's actually really hard work because these young people are really working hard to keep it together during the day in a kind of formal learning system that's not really quite modelled around their needs. So anything you can do that helps advocate for them in the setting and also show that you understand how tough it is for them will help them to be able to recognise that this is not that there's nothing that they've done wrong, there's nothing wrong with them, but actually it's not easy and you can see the efforts they're making. So I've put there just some kind of scripts and some language that you might use for young people. And it's recognizing as well that it's tiring and that they might need a break. And breaks are really key for ADHDers because even if it's something that we're really interested in, we can be tempted to override that need to take a break to the point that it leads to a burnout situation. Movement opportunities are absolutely key. So this is in schools, this tends to be our go-to, doesn't it, really? And I think it's absolutely imperative. I've got young people who are taking movement breaks every 10 minutes, and that's kind of fine. You can build them in. It doesn't have to be let's go outside and take a movement break or let's go outside and do a sensory circuit. It can be something quite natural and quite organic, giving things out or going to grab something for you, or when you move the groups around, or let's take a 5-minute break outside, anything that gives them that chance to move. And on a smaller scale, it can be things like fidget toys, or wobble cushions, anything that gives them that chance just to have sensory feedback and some movement. Competition and challenge can work brilliantly for young people with ADHD. So anything really that makes it into an interesting game, that makes it a bit exciting, even for quite boring topics, that can really help. And it doesn't have to be anything particularly complicated. It can be splitting groups into 2 teams. It can be, I bet you can't get 5 of these right. I bet you can't. Anything at all like that will create a bit of excitement and interest that is likely to engage them better than if it's just doing a task. So, you know, sometimes I'll be giving my class an activity to do, but instead of calling it a worksheet, I will call it a challenge or a quiz or a game. And then, you know, they love that competitive element. And when they get it right, as much praise as you could give them. ADHDers love praise and reward. And giving them a key role, so anything that lets them kind of showcase their natural energy and their character really, and makes them feel important would be helpful. Routine. So routine's a really tricky one for ADHDers because we need it, but we also fight against it because we find it quite boring. But where routine really helps is it gets rid of that challenge of the executive functioning. So it's the kind of where do I start? Where do I start with this? And feeling overwhelmed about how to get started. So having a routine gets rid of a whole load of stress before it's even started. And kind of patience and boundary setting, but without judgment or shame. And this is all about the language that we use. And you can set boundaries, you can contain behaviors and situations in a way that doesn't shame the young person. But it's about using language which is empathizing with them, collaborative, so you're alongside them. So instead of using the word you, it'd be we. Recognizing they find it really hard and saying, let's make a plan together, reminding them about rules, but not judging or shaming them, because that won't work. It makes no difference and it will just lead them to spiral. It won't help the situation in future. Ladders, this is what I call ladders and buddies. So if your young person has a task to do which is boring or difficult, these are the kind of scaffolds that can help get them through it. Because just knowing that they have to do it doesn't really necessarily make that much difference. So someone to be alongside you as you do it. So if you're working with a young person with ADHD, sometimes literally just sitting next to them while they do a task can be enough to help them get through it because they know that there's help there if they need it. Having a timer and a limited time span can make things feel a lot less overwhelming and a bit more interesting. So, for example, if I'm doing a writing task, I'll sometimes give the students literally 5 minutes to write as much as you can. And that kind of makes it feel much more manageable and also introduces that element of competition to be quite effective. And having what I call an always rule to reduce this challenge, this executive functioning challenge of where do I start? So, for example, an always rule about having an untidy bedroom might be I will always start tidying in the far right hand corner. There's no reason why it would be the far right hand corner at all, except that you're creating a rule so you never again have to wonder, where do I start? Because that decision is made for the rest of your life, and that's where you begin. And you can do that with all sorts of things. Having an always rule creates a routine that avoids the procrastination of when am I going to do it? How am I going to do it? Where do I start? It's quite a powerful thing if you can create an always rule, even about where to keep things. You know, every time I come home, I put my school bag in the cupboard, and you create that always rule. So it becomes just second nature. You don't have to think about it anymore. And planned rewards. So it could be that every 20 minutes of work that they do, they get 10 minutes to go and watch TV or 10 minutes to just go and have a walk around, anything really. And studying for ADHD studying tends to be like homework and revision can be really, really difficult. But I always encourage them to do literally 15 minutes work, 15 minutes break, small chunks of work, with really regular breaks and rewards, just to keep that motivation going and make it manageable. Otherwise, they won't do it, they'll procrastinate, and they'll believe more and more, I can't do it. And it creates a whole new barrier if they create unmanageable routines. And I'm a big fan of what I would call kind of helping them clear the chaos. So whether it's that they're overwhelmed with a piece of work, whether it's they're overwhelmed with mess and untidiness, their school bag's just a mess of worksheets and a broken orange, whatever it is, if it's to do with, getting started on a task in a lesson, they just have no idea what to do, they haven't started their coursework and it's due next week, whatever it is, if you can help them clear the immediate chaos, help them get started with it, don't feel like they have to struggle through it on their own for it to be valid. And it's just helping them get on top of a situation so then they can maintain it from there on as much as possible. Otherwise, it will spiral. And I sometimes, it's literally a case of, if the bag's a big mess and they can't find anything, sort the bag out with them. Just do it with them. And then you kind of clear one of the immediate problems. And with deadlines, I literally will sit with a child and we'll kind of go through and we'll try and work out what are your deadlines and what order we're going to do it in. Otherwise, it's just so overwhelming for them. Praise and reward is really powerful for ADHDers. It can be tangible rewards. It can just be language and words and phone calls home and stickers and stars and certificates. All of those kind of things are really effective. So it's noticing all the good bits and all the good efforts they make during a day.